Senator Alexander.
Thank you, Mr. Chairman. Welcome, Mr. Secretary. Senator Murray and I agree on many things. One thing we do not agree on is health insurance. For example, as you just said, the short-term plans she's talking about are the same short-term plans that existed throughout almost the entire Obama administration. And I want to congratulate the administration on the associated health plan proposal, which has the prospect of letting small employees of small businesses have a chance to have the same kind of insurance that an IBM employee might have at a much less of a cost, and with the same protections. You couldn't be charged more because of a pre-existing condition. You couldn't have your coverage denied because of a pre-existing condition. Your kids you'd have to give coverage to your kids up to age 26. There couldn't be lifetime limits. So those would, and in addition, rates didn't start going up with President Trump. They started going up with President Obama in 2013 with the beginning of Obamacare. They went up 176% in Tennessee since 2013. And we had a proposal which a month ago President Trump asked Speaker Ryan and Senator McConnell to put in the omnibus spending bill. They agreed. Oliver Wyman said it would have reduced rates by 40%. It wouldn't have changed essential health benefits. It would have allowed coverage for pre-existing conditions, no lifetime limits, and the Democrats blocked it. So that's a difference of opinion we have about who's responsible for the high rates, which are coming because of Obamacare, and Democrats blocked our proposal a month ago. Now, one area we agree on is the urgent need for response to the opioid epidemic. Senator Murray and I in our HELP committee unanimously, after several hearings, reported a bill a few weeks ago with contributions from 38 senators with more than 40 proposals to attempt to give states and communities and doctors and hospitals and judges more tools to deal with our largest public health epidemic. Have you had a chance to review that bill, and does the administration support it?
Thank you, Senator, and thank you for your commitment around helping to make options more affordable for individuals under the Affordable Care Act. And also, we thank the committee and the Congress for the bipartisan work on opioids. I've reviewed some of the elements of the bill, been briefed on them. The administration doesn't yet have a formal position, as you know, to state on the legislation, but there's so many very good things in there that I'm sure we'll continue to work together, and we'll run through the process of deciding on administration.
May I ask you to give it your priority, because the House of Representatives is working on opioids this month. They hope to produce a bill. I hope that our bill could go to the floor this summer, have contributions from other senators. We invited many of them from other committees to meet the witnesses at ours, and we would hope to be able to deal with this problem this summer. Let me move to something called the Medicare Area Wage Index. This is an index which has a big effect on how hospitals are reimbursed, the 5,500 hospitals in the country. And from our way of thinking, there is a big unfairness because of the wage index. For example, if a hospital in Connecticut is billed $100 to Medicare next year, it would receive about $126. But if a hospital in Tennessee billed Medicare for $100, it would receive $82. And as a result of that, a number of us in states, because of that discrimination, have introduced legislation to try to adjust the hospital area wage index, because it's causing hospitals to close. CMS announced a rural hospital initiative, but it didn't include any relief from the area wage index. Have you thought of ways to adjust the area wage index to, one, make it fairer, and especially to focus on rural hospitals?
Senator, thanks for raising that issue. The wage index is one of the more vexing issues in Medicare, and challenging in part because of the budget neutrality. And adjustment for any one state on the wage index actually hurts other states and leads to this constant back and forth of winners and losers there. And we have, and the prior administration have, suggested to Congress that we would like to work together to actually come up with statutory changes to adjust the wage index approach to ensure better equity. We every year are dealing with challenges in many states, in particular some rural areas, but but we have issues constantly in
Thank you.
certain East Coast states. So we'd welcome the chance to work with you and others on appropriate reforms.
My time is up, but I want to conclude by saying one other area we agree on this committee, and Senator Blunt and Senator Murray deserve great credit for their leadership, is their focus on biomedical research and the funding for the National Institutes of Health, and we hope to continue that.
Thank you, Senator Alexander. Senator Durbin.
Following up on